Okay, can everybody hear me okay?
Yes, yes, I can.
Yeah.
Right. Obviously, as titled, this is the story of my stem cell transplant experience. So it is a personal journey, not a commentary of the general usefulness of the procedure for a wide variety of conditions. It is now referred to as a stem cell transplant, or more correctly, a peripheral stem cell transplant, as the cells are harvested from blood rather than from bone marrow. It used to be called bone marrow transplant. My journey started back at the back end of 2006 when I was diagnosed with polycythemia rubra vera, which is a disorder of the bone marrow, a blood cancer where the cells multiply out of control and it makes too many blood cells, mainly red blood cells. The symptoms for me were some of the time I'd suffered with prickly skin, particularly after a shower, a hot shower. This would be, I didn't know what it meant, nor did I seek any help about it. But then I then did it's called an infarction, which is just a sort of a lack of blood supply to my spleen. This was diagnosed by ultrasound as an enlarged spleen. I had a spleen probably 22 centimeters as opposed to the normal spleen size of about 10 centimeters. Also, the blood test showed up that I had a dangerously high red blood cell count. Once I was confirmed, I was taken into a side room to have what's called a vivisection, which is a bloodletting. So they took a unit of blood off immediately, and then that followed to get my red blood cell count down. The blood volume would recover after each venesection, but the red blood cells would eventually come down because there was a high risk of blood clotting, which could have been extremely serious. And then about a year after that, once it had all settled down, I was put onto a mild chemotherapy drug, an old drug, which may be familiar to a few of you, called hydroxycarbamide. I think it's quite a cheap drug, and I was put on that, and that just suppresses the cell proliferation. And that helped everything settle down, and it kept a lid on things for a long time, and I eventually settled down to just having to go into hospital for tests and eventually but I was well, and I was working, and I was red blood supply. I was able to scoot up the mountains without any problems. However, having kept a lid on it and suppressing the cell proliferation for nearly 10 years, unfortunately, I turned a corner at the back end of 2016. Again, it was a bone marrow condition. It was a development, a transformation of what I had into what's called myelofibrosis. Myelo means of the bone marrow. Fibrosis is fibrous or scarring of the bone marrow, which then leads to blood insufficiency, which was the opposite of what I had before. The symptoms were a feeling of fullness, of bloating in the abdomen, which I was familiar from the previous diagnosis time, and also this pain in the spleen, and also bone pain. So I rang up Blackburn, I rang up the hematologist and said this is what I was experiencing, and immediately I was referred for an ultrasound, which confirmed increased spleen size, and followed a bone marrow biopsy, which confirmed the scarring on the bone marrow. The bone marrow biopsy was not a comfortable process at all, and one or two of you may have suffered that. But that it's done under a local anaesthetic, but it's still pretty grim. Taking a sample out of your pelvic crest on your pelvis. The diagnosis of the myelofibrosis, inevitably one of my questions was, what's the prognosis? My life expectancy from diagnosis was 80 months. So no huge rush, but at the same time a little bit daunting. And if I didn't have any treatment, it itself could have transformed to leukemia. So the treatment for this, initially anyway, was to put me on a very, very expensive drug, a new drug called ruxolitinib, which inhibits and controls better the production of blood cells. It slows down the progression of the scarring on the bone marrow, and I responded very well to this. Another welcome side effect was that it tends to reduce the size of your spleen, which is very preferable for the sake of the transplant, which was what I was next offered. And as a sort of long-term option was the stem cell transplant. This can take the form of what's called an autologous transplant, which is using your own blood cells to transplant. So they're harvested, and then you then go through chemotherapy conditioning, and then you then receive your own cells back, or alternatively allogeneic stem cell transplant, which is taking cells from a donor. The advantage of diagnosis is normally between the age of 65, 67, and I was 52. And this is another reason why I was offered the stem cell transplant. And the earlier you do it, the better. My general level of fitness was good as well. So then my consultant at Blackburn was then wanting to refer me to a local centre of transplant excellence. But it could have been Manchester as well, but Leeds were written to, and they wrote back with a slightly negative response, in the sense that I wasn't severe enough, and you know, my situation wasn't quite as advanced. At the same time, my sister, who'd recently hired from the health service in the North East, and who happened to live about 400 metres from Freeman Hospital in Newcastle, gave me the idea of, what about Newcastle? My initial response was, well, I can't go into Newcastle for months and months, or, you know, be a visit me. But the fact that she lived so close and there was a base where Carol could stay during visiting. So I discussed that with my consultant at Blackburn. They were a little bit unsure. They'd never referred anybody to Newcastle before. But she then wrote to a consultant that I'd researched in Newcastle. And this was at the Freeman, which is also the Northern Centre for Cancer Care. The Freeman Hospital does an awful lot of other transplantation, and so is a centre of transplant excellence. I'll just quickly, this is as much as anything just a contents page, which I'll quickly skip across because I'm going to go through this one by one. So I then had my initial consultation at Freeman Hospital with Professor Graham Jackson in June 2017, and he gave me great confidence that I'd come to the right place. He was absolutely excellent with his discussion of the transplant process, the risks. There was some risks to it, 20% chance that I would, during the transplant, I would be referred to critical care unit, and also the mortality. There was a 40% risk of mortality within a 2-year period of the transplant. But faced with the diagnosis, the prognosis of doing nothing, then it was a no-brainer. It was a risk that I needed to take. So having agreed it, then I was tissue typed, which is just simply a blood test, to check on my match for a donor. And this was a donor, an unrelated donor from a register where volunteers are prepared to go through the process of donating stem cells. And they are tissue matched as well. So the search goes worldwide, and it threw up 2 matches. And they call them 10 out of 10 matches. So a complete 100% match was a 52-year-old guy in the USA and also somebody from Poland. However, it may be some passage of time since they registered, but unfortunately both of them withdrew volunteering for it. So I was then left with the option of a 9 out of 10 match of a German. However, time had passed and things move on, and the current thinking had moved on to something else, which was to use potentially a related stem cell donor, somebody from your own family, which would probably be a half match, and they tended to look at siblings first, and they preferred somebody of the same gender. So my brother was tested to see what his match was. There was about a 20% chance of him being a 10 out of 10 match, but as expected, he was a 50% match. But unfortunately, he had also had a history of cancer. So then again, the current thinking was to look at children as being a 50% match, and this was deemed to be as good a match as a 9 out of 10 match, and I think was preferred ultimately from a point of view of potential future need if there'd been a relapse, that to look at children. All of them were tested. I've got 2 daughters and 1 son, but the son was preferred due to gender and again no medical history. At this time, which was January 2018, I then asked if I had a choice of whether I could time my transplant, because I was feeling very well and they seemed to be very pleased with me. My daughter Katie was in the 2nd year of 6th form at the grammar school, and was taking her A levels that summer. And I knew that my transplant would cause quite a lot of upset in the family. So I asked whether it could be deferred. And the consultant just said, right, we'll get you in the week after her A levels finish. Stephen himself was then counselled by a different team at the Freeman, so there wasn't any conflict of interest. But a week to 10 days before my transplant, we're now talking live. I went to just check that the transplant. So I had a chest X-ray, lung function test, blowing into machines at high pressure and holding it, which was dreadful. Electrocardiogram. This was all done one morning, and quickly followed by yet another bone marrow biopsy. They wanted a marker for immediately before the transplant. In the afternoon, I was then taken into theatre and I had a Hickman line fitted, which just made infusion, the transplant, and all the drugs so much easier. Without that, it would have been awful. So that was worth going through. Beyond that, the mission was on the 13th/7. Day 0 is the day of the transplant, so this was day -7, and followed an intense and precise schedule of the chemotherapy protocol. Followed from 5 days immediately after my ward. I was on just a side ward and didn't feel too much effect from that in the immediate term. The longer term effect was long lasting. At the same time as me receiving the chemo, you can just see the chemo protocol there, but you don't need to read it. But it was pretty. It had to be very precisely followed. Stephen received injections once a day to mobilize his stem cells into his bloodstream. He doesn't like needles at the best of times, but it created some bone pain as well. So he was a bit uncomfortable with it and struggling to walk. And then on the Wednesday, the day after his last injection, his stem cell was harvested. And I don't know whether you can see, you can't quite see possibly to the right of your screen. There's a machine which takes his blood out of one arm, centrifuges it and puts it into his other arm, returns it into his other arm. The centrifuge then takes out the stem cells, and which is the bag on the right hand side you can see, and they also harvest some plasma which can be used at a later stage if necessary. That hasn't been necessary actually. The harvesting took about 5 hours, and he was reasonably comfortable during that, just bored I think, and he was back at work the next day. The transplant itself was completely unremarkable. This was on the week after I was admitted. This was day 0. Everything was measured from day 0 onwards. Can you just press that again? Again, the picture's not particularly well sighted, but there's essentially just a tripod with a bag of Stephen's stem cells going into my Hickman line, which was straight into a vein near my heart. And then I had further conditioning of chemotherapy, for 3 days following that. Again, just on the side ward. But as soon as that finished, I was then straight into isolation, which was in a single room with a wet room off it, a window that you couldn't open. The air was filtered before it came in. There was an ante-room so that anybody coming into the room had to get kitted out in PPE before they came in. And there's a picture of Catherine, my sister, and Carol fully kitted out with the PPE. There's an image behind of what one of the walls on the wall, which was a forest with bluebells behind, and this was just my outlook for the next 3 weeks. Yeah, and also followed 24-hour monitoring, which was pretty intrusive and very regular. This was the worst stage of the whole transplant process, and this was waiting for the stem cells to engraft in me and take effect. In other words, for me to start producing blood cells and to adopt a brand new immune system, essentially Stephen's immune system. I was on an awful lot of drugs. Some of them were preventative drugs. The sickness, chemotherapy gives you nausea, but it is extremely well controlled these days. I got anti-sickness drugs, which worked very well, although one of them had a particularly awful side effect of nightmares. They were terrible nightmares. So they quickly took me off that and put me on something else, and I was fine after that. You're on antivirals and antibiotics. Again, as preventative, but during the time I did need them as treatment. Immunosuppressant drugs to help avoid rejection of the transplant. Transfusions, because my bloods had gone absolutely through the floor, I needed quite a lot of transfusions of blood and platelets, and during the time I was in hospital I received about 19 units of blood and platelets. My appetite similarly just didn't exist. I just couldn't face most of my food, and this got quite worrying. All I could tolerate was, but there was virtually nothing else going in at all. So eventually I had to have a nasogastric tube fitted, which wasn't a very comfortable process, nor was it comfortable when I had it in, as it prompted hiccups, which were awful and lasted for a long time. Lethargy, as you can imagine, after the chemotherapy. I had all sorts of ideas about reading while I was in there to avoid boredom, and also I even thought that I might even try to learn Spanish. Absolutely not. I couldn't be bothered to do anything. There was constant interruptions all the time, so I never got bored. I suffered hair loss as usual with the chemotherapy. That happened sort of a couple of weeks into the transplant. It just fell out in huge clumps on the shower floor. As expected, I did suffer some infection. I don't know where it came from. Some of it comes from yourself. Some of it might have been introduced despite all the efforts, but they were pretty grim infections. The temperature went through the roof, and I suffered a couple of episodes of rigor, which is just uncontrollable shaking. So from that point onwards, my monitoring was redoubled at least. I had numerous visits from intensive care nurses and doctors, and I was ready to go down, if necessary, to intensive care. Fluid gain was a minor inconvenience. My legs swelled up, but I quite enjoyed the aromatherapy and massage to get rid of that. Toileting and showering was a huge effort, and the fluid gain meant that I was also on diuretics, which meant that I was trotting to and from the toilet. It was such an effort. That was virtually on a drip all the time, so I had to trundle a tripod with a drip on into the toilet, recover on the toilet, and then sort of wash my hands and get back to bed, all of which absolutely floored me. Again, because of lack of feeding and everything else, I lost 10% of my weight in 3 weeks. I was not quite skin and bone, but I was pretty grim looking. But all this time, I can't complain. I had absolute family support, so convenient. Catherine living just down the road. During my worst 3 weeks, Carol stayed with me probably nearly 100% of the time. She slept with in the room on a couch that wasn't made for sleeping on. She was sleeping in full PPE, and every time I trotted to the toilet, she was up and helping me. So she attended to most of my nursing, and was a big help to the staff there, but even bigger help to me and my mental well-being. Catherine helped by deputising for Carol just for maybe an hour or two each day, and allowed Carol to go home, have a decent meal, and shower and get changed. At this time, I was allowed only 2 visitors, which ended up having to be Carol and Catherine. My mum and kids, I needed the following news, which was the recovery after engraftment, which was 2 weeks later, and this was a huge milestone. This was when my bloods showed that I'd started to produce neutrophils. That had been at 0 since, and so my immune system was less than a low ebb. But now there was light at the end of the tunnel, and the neutrophils started to rise, and this was just fantastic news. I knew it was fantastic news, but I had absolutely no emotion. I was just expecting it. Catherine and Carol, I think, got quite emotional. My lungs suffered. I had fluid on my lungs. They were going to do an aspiration on my lungs. It was fluid between the pleura, and but it was too risky because my platelets were so low that I couldn't. They couldn't risk a bleed. So it was just treated with diuretics. My liver took a hammering, and I suffered blood clots in my liver, sometimes known as veno-occlusive disease, and was treated with an extremely expensive drug, which is a pig extract, and that was over the period of 21 days, and I had that every 6 hours, and it probably took a couple of hours each infusion, so that was just virtually constant. It cost an awful lot of money. Big milestone again, I managed to get wheeled out in a wheelchair on day 18 just to the door of the hospital, and just to have fresh air blowing over my face was just fantastic. Day 20, I managed to walk 10 meters. My sister, who was a physiotherapist, was bullying me to get going. And then the day after, I managed to walk 50 meters, but wheeled back into the ward on my wheelchair. Soon after, blood was taken again to do what's called a chimerism test, which analyzes the genetic material in the blood. And normally, you're expected to have 96–97% donor material. My result came back 100%. That was quite emotional. And then finally, I was discharged on day 28. Everything was looking good, and everything else was taken control of. But then followed my long-term recovery. I was just round the corner at Catherine's, but back in a normal bed. I still needed to be close to the Freeman because I was going in twice a week for outpatient appointments. Again, the bloods were such that I needed further transfusions as an outpatient. This usually happened in between the other outpatient appointments. Gradually and thankfully, my drugs were stepped down over a period of time. I suffered more infection and had an awful bladder infection, but I wasn't needed to be hospitalized. Yeah, the picture is again it's a little bit obscured, but it was me at my first trip out, and that was to Tynemouth. You might recognize it, but my wheelchair is just out of the picture. Yeah, you can go on to the next one as well. Yeah, fluid on lungs was just ongoing. Something you can suffer when you have an allogeneic stem cell transplant is what's called graft versus host disease. Because you adopt a new immune system, normally with a transplant, your graft or your transplant is the foreign material. In this case, your new immune system recognizes the rest of your being as being foreign, and so can start to attack it. And this can manifest itself in very serious conditions. Happily for me, I've only suffered minor symptoms of skin rash there. And again, just build up bit by bit over the week, strength and independence. I managed to make a first trip home. That's me just on the riverbank, just down the road from here. I managed to make it to Cyril Royal's bench, just on the riverbank, but I was absolutely knackered. Thankfully, longer intervals between the outpatient appointments allowed me to come home. So I was only once a week, so I was able to, which was a Monday morning for the outpatient. I was then able to go home Monday afternoon and then return Sunday evening, ready for the next Monday morning appointment. The longer intervals allowed me to then look at weekends away, trips out of my immediate situation. And this is a picture of me in January, still looking a little bit gaunt and with the hair just starting to grow back. But I was fit enough to go to this, which was a real milestone. It was a long-term goal for me to get there, and I managed also to help with the catering that weekend. And then come the March, I then had a phased return to work, which was great. Just being able to go 1 day a week back, starting to do car deliveries again, and gradually build that up 2 days, 3 days. More recently, I've gone to 4 days. At the 12-month interval, I was also given my childhood vaccinations again. In conclusion, my current health is very good. I'm now only needing to go up to the Freeman once a quarter. I'm still classed as critically extremely vulnerable, which I hate. But fingers crossed, I'll get the jab soon and I'll be able to help you. My stamina is a little bit compromised still, and I suffer from lethargy. If I've had a long day at work, I really can't cope with another day, and I'm regularly needing to sleep in the middle of days. But I count myself extremely fortunate that I was offered the procedure. I had age was on my side and my fitness was on my side, but it's an extremely expensive procedure, costing the NHS, so everybody, around about £750,000. But there was this potential for a cure, and prognosis of a normal life expectancy. If I live beyond 5 years from the transplant, then I'm expected to live another 15 years. Press it again, and just to say what a fantastic facility there is at the Freeman Hospital, and what first-class care I received. And there's the picture here is of a few of the team that looked after me doing the Great North Run the year after, on behalf of the Bright Red Cancer Charity, which is based in the Northeast, and looks after the welfare of patients in the transplant situation, looking after the facilities that they have, improving the rooms that they're living in, and also the long-term care. Again, I'm so fortunate to have received the family support that I received, as I've alluded to before, but also the community support that we enjoy as Rotarians, and the community that we have in Clitheroe is fantastic. I received so many cards and letters of support during my time up in the hospital, and texts, and Carol was able to respond on my behalf, but it was absolutely fantastic, and you know, I hope to be able to repay that and that debt to society and the community that I live in. Okay, any questions?
Thank goodness.
Is everybody unmuted now? If you'd like to have, if there's any questions, I'd be happy to answer them.
Oh, it's Andy here. Bill didn't give us that kind of detail update while this was all going on. He missed loads out, Ian. So the quality of Bill's updates were called into question now. Thank you.
Well, that's all right. I just want to say one thing. It's not a question. I just want to say that if that was $750,000, it was worth every penny.
Indeed, yeah.
Thank you. I still feel that I've got this a debt that I need to repay to the society. So I hope to be able to do that.
You look so well now, and you're feeling well, and you're walking. It's wonderful to see you. Yes.
Yeah, it's amazing.
As you well know, Ian, I had same or similar treatment. Mine was an autograft, whereas yours was a donor graft. Mine is now coming up to 23 years ago, and they're quite right. Make 5 years, and you're a few more years to go. So I was 50 when I had mine done. You were 52, so you have a long road ahead of you. And all I can say is, having been through it with you, it's character building is the best way I can put it.
That.
Character building.
It is indeed.
Grueling.
Well,
Thank you very much.
thank you, Ian, for a really detailed and illuminating trip through the whole process. And I think a lot of us probably didn't know anything like that kind of detail about what you were going through. So thank you for sharing that with us. I could hand you a pen, but you'll have to wait for it for another day. We're
Very much for having it.
We're
Can I
running
show
out of,
appreciation in the usual way?
yeah, I think we should. I keep breaking up. So thank you, Ian. Rotary Fellowship and peace the world over.
Rotary Fellowship.
Rotary Fellowship.
Peace the
World over. Cheers.
Cheers. Thank you.
Well done.
Thank you, Ian.
Well done, Ian.
Yes, well done.